Hey YouTube, how are ya? My name is Cassie Haney and I'm one of the owners at Impact Laser Therapy and Wellness in Amarillo, Texas. And today we are going to be talking about laser therapy for sports injuries. And I've decided to approach this video as I would if you were like my cousin and you lived out of town and you had like a senior in high school who had gotten injured on the field or at practice, and you're asking me questions about getting lasered, using the laser for your sports injury, your athlete. And I'm going to tell you everything I would tell my cousin or loved one who really needed answers about this whole process. So let me get started. And the first thing I'm going to address is laser therapy a good option for sports injuries? And the answer is a resounding yes. Sports injuries are one of the areas that the laser is the best for. We call it an acute injury to the soft tissue or the joint. So if you have an acute injury, that means it just happened. An acute, sharp injury just hit you to the soft tissue or the joint. The laser is going to be extremely effective in here's why. The laser will help you get through the stages of healing faster. It pushes you through the healing process faster. So the healing process can happen for your athlete faster with the laser than it can without the laser, and it will also address pain and inflammation through that process. So it is a very effective way to deal with a sports injury. And the injuries that are coming to my mind right now would be like sprain, muscle sprain or strain, throwing injury to the shoulder, knee, like if, sometimes we get athletes who have, like they get pain in their knees from practice, especially I'm thinking basketball. Football players, a lot of hamstring injuries and glute injuries. A lot of volleyball players, we get a lot of ankle problems and shoulder problems. So any sports injury is going to benefit from the laser, and it's going to push you through the stages of healing faster, and it is a very good option for sports injuries because you're not giving your kids meds. You're avoiding medications. You don't have to go to the doctor. And because what the doctor is going to do is prescribe medications. So if you are trying to avoid the use of meds, and if you want to get them through that process faster, then the laser is a great way to go. Now, how does the laser work? I've covered this in other videos, so I'm going to try to be quick about this. But basically, every cell in your body has mitochondria in it. And if you know anything from science class in high school, you know that the mitochondria is the powerhouse of the cell. And it's the powerhouse of the cell because it's where you make ATP. And that is actually true. So the laser works together with that process by giving your cell photons. So it throws photons down into the cell. Those photons attach to the mitochondria, and your mitochondria does what it does. It creates ATP, which basically energizes your cells. And so whenever you go to use laser therapy for sports recovery, you're not just going to get one treatment. You're going to get the magic number really is 6. 6 is the number where it's the least amount of treatments for the most amount of benefit for an acute injury. So you're hopefully going to get at least 6 or 7 treatments. And what that's going to do is you're going to fill the cell up with energy, and your cell's going to burn through that energy to do whatever the next right thing is it needs to do. And as soon as it's burned through that first round, you come in for your next appointment, you fill it up again, it's got another round of energy to burn through. Your third appointment, it goes around again and again and again. And by the time you've had 6 or 7 treatments, a lot of healing has occurred. Your athlete's feeling way better, and hopefully they're able to get back into the game. It does kind of depend on the severity of the injury. We're talking about moderate injuries, sprained ankle, thrown out back, you took a hard hit, maybe they have a deep bruise or a contusion, something like that. That's where the laser can definitely come in. So yes, laser therapy is a great option for sports injuries. That being said, there are a couple questions you need to ask before you walk into a clinic and you decide to hire that clinic to give you your laser therapy. And these are the two questions. Number one is, are your technicians certified, and do they have experience with sports injuries? They should have experience with sports injuries if they've been doing that for any length of time at all. And you want them to be certified because you want them to be concerned about safety. And the other big question to ask on the phone before you go into the clinic is, what type of laser do you have? There are 4 classes of lasers that are used in this way. Class 1 and 2 are very weak. They're very low level light, and they don't penetrate any depth at all past the skin. And so if you have an injury that's deeper than skin deep, class 1 or 2 is just really not going to help you the way that you're wanting it to help you. Same with class 3. Class 3 goes a little bit deeper than the 1 and 2, but the best is definitely class 4. It can go up to 2 inches of depth into the tissue. And so you know, if you have an injury deep in your knee, a laser can be shined all around your knee from every angle, and it can penetrate all the cells from every direction into that knee, and it can really cause a lot of healing to happen in that joint. Where if you're just only going, you know, a few centimeters into the skin, you know, those cells are really going to benefit the ones on the skin, but nothing's really going to change deep inside the cell. So before you go in, ask, are your technicians certified? Do they have experience with sports injuries? And what class or what type of laser do you have? You want it to be a class 4 laser for sports injuries. Okay, next question. Whenever you go in for your first appointment, what are you looking for? How do you know if these people know what they're talking about or not? And I'm going to tell you. So what you want to see is there to be some kind of an intake form. You need your technician to give you some questions that you're going to answer and fill out, and then they need to go over those questions together with you. Your technician should be asking you, what happened? How did this injury occur? How long ago did it happen? What have you been experiencing? Where is your pain? Does it move? Is it better in the morning or the evening, or is it worse in the morning or the evening? What types of things can you do to help it? What things that you do during the day make it worse? All of these questions are going to help your technician whenever they are choosing a protocol, or they choose the settings to put the laser on to help you with your injury. So these are questions that you hope that they are asking you. That is a very good sign. If they ask you a lot of questions, they listen and they hear everything you have to say, and then they take that information and they apply it when they program the laser and what wattage they're going to use, which can and probably should be changing over the course of your treatment. So that is a big one. Next is your laser technician concerned about safety? And there's really only 2 things you have to worry about with laser therapy. But if you don't worry about these things, this is not a clinic that I would want my cousin going to, or my niece or nephew. So here it is. If you go to a clinic and you're in a room where there's a laser that is turned on, everybody in that room needs to have eyewear on. The laser really can damage the eye. So please make sure that you're in a place where they are concerned about eye safety, together with the laser. And also, they need to be concerned about making sure that the temperature. So they should be asking as they go along, how does this feel? How, is it too warm? Do you feel the heat? And you should be really saying, you should be thinking and feeling, yeah, it does feel warm, but it feels really good. It's not too hot. That's the kind of information that they should be gathering. And then as you go from treatment to treatment to treatment, first of all, I'll just tell you, the amazing thing about the laser is, it's hard to over laser, and your technician should know that. And your technician should know that, they can laser just directly over the place where the injury happened, but if they broaden that area a little bit, you're going to get better results. So you want a technician that really has a heart to help you with your injury. So what that means is, not only are they going to apply the light to the place where the injury actually happened, but they're also going to expand that area. And if you're anywhere close to the spine, like if you have a shoulder injury, they're going to follow the nerve pathway back to your spine and then get up and down your spine. They may get up the side of your neck. They may go down your arm. A good technician will say, does it cross this joint? Does it cross this joint? They're going to want to ask you questions, and they're going to cover the area. They're going to cover the area. Lasering really doesn't take that much time to just do where the specific injury is. A good technician will take an extra few minutes to broaden the area and chase the pain. Also, as your treatments continue, sometimes pain moves and the injured area shifts and changes. So if you have if you had an initial blow, to the side of your arm and you've got all this pain, well, if we start here and we really target this area, we want to make sure we continue to touch that place every time. But it might be like, it's kind of moved back here now, or it's moved to the front, or it's moved down my arm. That can happen anywhere all over the body. Pain does move, and the movement is a good sign. And so you want a technician that asks you every time that you come in, how are you feeling? How did you feel after your last appointment? Has anything changed since the last time I saw you? Where are you feeling it the most today? And they should hit the areas that they hit every time. And if there's any change, they should make sure they spend, a full minute or two on the places where you're feeling the pain today. And the other question that I'm going to answer today is, how much should you expect to pay? I'll tell you, at our clinic, we charge $300 for the 6-pack. 6-pack is our standard treatment for an acute sports injury, and according to the research, it is the magic number. And so I would hope that that would be what you would get, wherever you went. And the other thing is, $300 for 6 treatments. At our clinic, it's actually 7. We usually give a quick laser on the day of your consultation, and we don't charge for that. And then we start your 6-pack whenever you come back in. We're going to want to see you 2 to 3 times a week for 2 to 3 weeks. So that would be, hopefully get your first 3 sessions in pretty quick, every other day or once every, 2 or 3 days. And then you can spread those last few sessions twice a week if you want, unless you just want to be more aggressive about it. Then you can get all 6 treatments in a 2-week time period, and that's great. So about $50 a treatment is about right. And I'll do a quick recap. Is laser therapy a good option for sports injuries? Yes, it very much is. And it will help your athlete get through the stages of healing faster, and it will help them get out of pain. It is important that you go to a clinic where the technicians are certified, and it is important that they have some experience working with sports injuries. It is also important that they are concerned about safety, meaning they should be asking and checking the temperature of the laser, and they should be concerned about making sure everybody in the room has on eyewear. Your treatment should be over the area where the pain is, and then it's okay and really the sign of a really good technician if they broaden that area, or if they say, was anything else affected whenever this happened? Is there anything else related to this problem that I can go ahead and hit with my light while you're in here? That's how you know you have a really, really good technician. Also, as your treatments go on, they should be asking you about changes. What changes have occurred since the last time I saw you? How are you doing? How are you progressing? And that's what you want to look for. That's how you know if you're getting a good treatment. Other big thing is, it's got to be class 4 laser. Make sure that you're going to a place with class 4 laser. Otherwise, the depth just is not there. Okay, if I missed something, please put it in the comments and I will answer it in the comments, or I'll just make another video. Hope you have a great day. Talk to you later. Bye.